Carlos Diaz, Neuronet project leader from Synapse Madrid, Spain. Carlos Diaz has over 25 years of experience managing complex international projects at the National Microelectronics Center, Municipal Institute of Medical Research, Fundación IMIM, and not very good at acronyms. So at the Center for Environmental Epidemiology in Barcelona, of which he was managing director. Since 2008, founder and CEO of Synapse, a company specialized in the high quality management of complex research and development projects in the health sector, with extensive track record on research projects that are highly innovative, large distributed and internationally oriented, with broad expertise in initiatives supported by the European Commission and Innovative Medicines Initiative. He is currently leading the project management activities in numerous joint initiatives, including eTranssafe, EHD Anin, ERA 40B, and Neuronet, in which he also acts as project coordinator. Sorry, Carlos, for mutilating all these acronyms. I am sure that you will introduce them yourself. So you are most welcome, and we are looking forward to your presentation.
I am sorry for the many acronyms. So thank you, Eva. Thanks to the organizers for having me today. So I just want to summarize a little bit what we've been doing with Neuronet, which is one of the projects in the portfolio, in the neurodegeneration portfolio of IMI that Pierre has mentioned. Neuronet is a very small project. What it is called a coordination support action, and it is essentially aiming at finding synergies and promoting collaboration across the different projects in the portfolio. So it is a little bit of a special project in the sense that we do not do research ourselves. We're trying to just help integrate the whole portfolio within IMI. So next slide. Allow me first perhaps a reflection, because I think that we all realize that science is capable of great achievements, but there's also many problems with the scientific system as it is set right now. So next slide. And some of these problems have been known for decades. Some of them are fairly new. So just look at the last one, for example. The advent of the media and media-prone scientists is a fairly recent phenomenon, I would say. But there's also, I think that probably the most important one is the fragmentation. So a lot of the science is based on projects, which is a very useful concept for carrying out research activities, but it also means that it has a beginning and an end, and therefore it has problems sometimes in terms of sustaining funding, in terms of leveraging the best lessons learned from each project, etc. So as a consequence of all of these problems, if we can go to the next slide, my feeling is that I wouldn't dare to say tribal, but I would say medieval organization of science sometimes, in which every institution, every pharmaceutical company, every academic institution, or every scientist even is trying to build their own castle. And we all know castles were built essentially for defense. So because of the competition, because of the a fight for funding, etc., everyone is trying to build their own, in the nicest way possible, their own castle. But of course, that goes to the detriment of communication and collaboration, etc. Everyone is trying to defend their own niche. So if you can click, Gladys, a couple of times. The question here is, can science now provide the actionable results that we need at the needed speed as well to face the challenges that are actually plaguing humanity in general? One of them, one of the most prominent perhaps being Alzheimer's disease, but also other neurodegenerative disorders. And it's a system set up for that. So I think that is at the genesis of what Neuronet intended to do. Neuronet was established as a very systems leadership oriented initiative that tried to find the common ground and promote the bridges between the different castles as much as we could. So if we go to the next slide, this is the landscape that we faced when we started Neuronet 2 years ago. And the acronyms that you see on the left are the logos of the different neurodegeneration projects. As Pierre mentioned, some 20 projects right now in the portfolio, but there's also multiple connections of projects with other initiatives, global, local, national, regional, you name it. And all of them may be relevant in certain aspects. So this is a very complex landscape. If we click once more, Gladys, including some projects that may not be focused completely on neurodegeneration, but that have, for example, as use cases, connection points with neurodegeneration, we're talking about almost 400 million in terms of investment. Almost every European Union country, more than almost 300 organizations, different institutions involved in these projects, more than 2,000 individuals working for these projects daily. So it is a lot that IMI has been mobilizing in the past few years in terms of research for neurodegeneration. So if you go to the next slide. So what we try to do is to try to understand this whole landscape in a very simple way, systematic data collection on the one hand, so trying to understand the scope, the timings, the objectives, the funding of each of the projects, then having one-on-one interviews with the project leads and some of the project partners to understand very well their logic behind the project, the cultural references, the behavior of the different partners in the projects as well. And then we implemented some surveys as well, for example, in terms of collaborations, attended collaborations between projects and whether those were successful or not. So next slide. As a result of that, we have come up with what we call the knowledge base, which is a publicly available website that tries to represent the wealth of research results, the richness of the IMI portfolio on neurodegeneration. It intends to be a little bit like a dashboard that you can navigate and try to see whether one project has these results, this other project has these deliverables, what are the timings, etc. So I invite all of the audience to actually check the knowledge base. I think it's a novelty resource that could be helpful to actually have an idea about what the IMI neurodegeneration portfolio is mobilizing right now. It includes an asset map, and I'll go back to that concept in a few minutes, which tries to extract the most tangible results from the projects and locate them in a map, which is that colored circle that you see there in the middle. So next slide. This is the asset map in full display. You should be able to actually, when you go to the knowledge base, click on each of the logos of the project, and that will take you to a different result from that project. So what we're trying to do is to move a little bit away from the project logic and say, yes, the project concept is useful for a while, but after a project, what remains is the asset. And this is actually what should be sustained in the future and what should be leveraged by others as well. So we feel that the changing in philosophy, a little bit transitioning from the project logic to the asset logic is a useful move, and that was actually well received by all of the projects. The map itself also allows you to see where there are, which parts of the map are a little bit overcrowded and which parts of the map are a little bit empty, which may also inform future decisions in terms of funding towards IHI or other funding programs. So if we move to the next slide. Another side of what Neuronet does is try to assess the impact of the IMI projects on society, on the field in general as well. So we've been developing a number of network diagrams in which we try to represent the projects, the connections between the projects, for example, in terms of common institutions that are participating in the different projects. And then you can see clusters of the different focus areas that are interesting to see as well, to try to understand better what happens on the ground beyond the big funding decisions. What happens then when you actually give the money to people and they go away and start to do stuff? There's also network diagrams for publications, I think, which is important in terms of academic impact. and also a huge diagram that I invite everyone to try to navigate, which is connections between institutions as well, and that is the partners diagram that you see over there. But another thing that I think has been perhaps paid little attention to has been what is the impact on the pharmaceutical industry. And we all know that at the genesis of the IMI program, there's the needs of the industry in Europe and how we can actually multiply the impact that the industry can have on for the benefit of the patients. So if we move to the next slide, I think this is probably a first. We try to implement a survey on personnel, on staff of the pharmaceutical industry, and ask them a few questions. What has been the impact of IMI projects on your daily work life? How do you perceive that the IMI projects may have impacted the visibility of the company or your capacity to attract talent, etc.? So these are only interim results. So we're finalizing now the analysis of the data, but with 90 respondents, which is not bad, from 20 different companies at least. What we see here is that most of the respondents, 63% of the respondents, thought that IMI projects had a mid to high impact. So this is just for clarity, on a 5-point scale, either 4 or 5 in terms of scores. So 63% thought that the impact was rather high in terms of the presence or the visibility or the image of the company towards society in general. 47%, almost half of them, thought that it had a positive impact in terms of establishing strategic partnerships. 41% in terms of attracting new talent. And importantly as well, almost 40% thought that it had a positive impact on the objectives of the company, the very objectives of the company, or the therapeutic area that they're working in. 30% thought that it had an impact on how their daily tasks were performed. So I would say that, considering that there's billions involved in the whole of the sector, a moderate investment like 400 million, which is important, but in context maybe it's not that huge, had quite a significant impact actually on the daily life of people working for pharmaceutical industry. So if we go to the next slide, now there's going to be like 2 or 3 very text intensive slides, so bear with me. Because I thought it was important for the record to just keep almost verbatim the comments from projects. So when we ask projects, what's the most important things, what are the benefits of IMI, what have been the drawbacks a little bit, or what are the issues that you're encountering? In terms of benefits, I think that it was clear from Pierre's presentation. There's a wide consensus that there's been a very positive impact of IMI in terms of innovation, in terms of increasing collaboration across competing companies and competing researchers, especially across companies, I would say, because they're getting used to collaborate and seeing them not as the enemy, but as a potential collaborator, and therefore, alliances are being built more naturally, I would say. Important as well, the impact, and this is an aspect often, I would say, neglected, on early career researchers. These are people that are young, not many years after their PhD, that are exposed to world-class research, world-class environments, and that is, of course, very useful in terms of their training. So there's a number of benefits that are very clear. I think everyone agrees with that. But if we go to the next slide, however, there are, of course, things to be improved. For example, 1/3 of the attempted collaborations between projects were unsuccessful. And that is because simply, the legal restrictions that affect the IMI framework or the specific project were too limiting. Or there were timing issues. We know of a collaboration that wasn't successful simply because the mice were too old. It just took too long to sort out the legalese. And therefore, it didn't make sense anymore to actually collaborate. There's also a need for more flexibility. This is something usually demanded by projects in terms of how can we more easily expand certain areas of the project, even terminate other areas of the projects with a minimal fuss. it has been mentioned before that, better communication in terms of what's out there already, what has been produced by others, so as to avoid duplicative efforts is important as well. And in general, I would say that people were a little bit worried about the lack of perception by the general public and funding agencies in general. There's a lot in terms of social and psychological aspects that are critical for collaboration, actually. So sometimes people just say, look, projects A and B should collaborate because it is obvious. A has this result that could be used by B, and therefore they should collaborate. And there's, of course, the legal aspects, the financial aspects, the timing aspects, but there's also psychological aspects, I would say, social aspects that require a specific effort to solve and to facilitate. If you go to the next slide, one of the aspects that are most concerning for researchers, again, working on the ground, is, of course, sustainability. How do I continue? We've got this set of very interesting results. We would like to go to the next stage. How do we do that in this framework? And I think that there's a number of problems, and actually, these are very good insights into why sustainability is especially difficult. That go from the long period that elapses between the conception of the project, the design of the project, and the moment where you actually are getting the results in a sufficiently tangible way, to lack of incentives, the institution not being the same thing as the researcher, for example. So the researcher sometimes sees the value very clearly. The institution may not think the same thing. And a general lack of knowledge and experience on business planning, moving in the market in general. So I think all of those aspects are also very informative towards perhaps the next framework program, future projects that could take these aspects into account to improve their sustainability strategies. Moving on to the next slide, please. So what did we do in Neuronet to try to improve on the situation? Aside from eliciting knowledge from the projects and understanding the lessons learned so far, we implemented a number of strategies. One of them was creating a scientific coordination board. I think it's the first time that the leaders of the 20 projects were sitting around the table for a number of times now. I think we are now on our 6th scientific coordination board meeting. And this is to just align in terms of strategy, in terms of direction, to get to know each other simply. And this is the orange oval that you see in the diagram on the right. Complementarily, we also established working groups. This is not for the leaders necessarily. This is more for the geeks in every project on a number of areas, so that they can discuss amongst them, have more technical discussions around certain aspects that are typically problematic in projects. We set out 4 working groups. We set up 4 working groups on data sharing, ethics and privacy, regulatory interaction, and sustainability, which were 4 of the main problems that people are facing. And you see the blue box there on the right as well. And finally, the third leg of the stool, if you like, was task forces, which is the green box. So if you click once, Gladys, I think I highlight there the triangle that is the structure. No, go to the previous one. Not yet. Okay, which is the triangle of the structure in Neuronet. So all 3 pieces, I think, are combined. Task forces are designed to actually tackle specific synergies, make a conscious effort to take forward a specific collaboration between projects. So if we detected that data set from project A could be used by project B, we try to facilitate that process and see exactly why. For example, in one of the cases, there have been discussions for 2 years, yet nothing had happened yet for a number of reasons. So we've been working on that for months now, and I think we're getting somewhere now. But I feel that without that specific effort from someone taking responsibility for taking the collaboration to port, say, it would be very difficult. So in general, I would say Neuronet has been approaching the objective as oriented towards systems leadership, a very participative structure from all of the projects. We have no agenda whatsoever, so we are not academic in nature, and therefore we're not obsessed about specific area in the field, whether imaging or certain biomarker, you name it. We are completely neutral, and I think that was appreciated as well by the projects. As I said, try to move the center of gravity from the project to the asset, and I would even say from the project to the people as well, which I think is very important. After all, all of these very scientific projects are carried out by people. So you have to manage people in order to get the best of everyone. And trying to highlight and generate actionable innovation, especially through task forces. So just as an example, if we go to the next slide, one of the ideas that I'm more proud of, perhaps arising from Neuronet, was to see whether there was a need in Europe to have a continuing parent cohort, which we dubbed the Neuro Cohort. This concept is trying to follow up participants over a long period of time, potentially endless, having a very wide representation across many countries, many clinical sites across Europe, and have a minimal follow-up of the patients, but continuing forever without the limitations of a project, certain project timelines. And the idea here would be that if we have this kind of European parent cohort, then all kinds of projects looking at digital endpoints, or projects looking at certain biomarkers, or sleep patterns, or relationships with other diseases, etc., could be implemented on top of that Neuro Cohort. And this was a little bit of a crazy idea because we didn't know how people would react. So if we move to the next slide, we proposed this to a number of research and clinical sites across Europe, specialized in Alzheimer's in this case. And we found that there were almost 40 sites that said, yes, we have to do this for the benefit of the patients and for the benefit of the sites, actually. Because we will be exposed to many more projects. We are not depending on whether we participate in one consortium or another. We think that this is going to be good for everyone in general. We're right now developing a pilot activity with 7 of the sites, but these 39 sites altogether are following up already in the local cohorts, some 25,000 participants, more or less. So I think that we have the embryo of a very nice and very European initiative that could become an important asset in the future as well. So moving on, in the interest of time, this is a list of all 39 sites. We have, all of the usual countries, but also Poland, Romania, Turkey. I was very happy to see that these countries were also very keen on participating, and we're looking at even expanding more the roster of centers. I mean, the bigger the Neuro Cohort is, the better we will be serving future research projects as well. Moving on, Gladys, please. And finally, we also wanted to know, are we doing the right thing or not? And how valuable is Neuronet itself? And we were asking then the projects, look, let us know if we are doing something of value or not on a number of fronts. You see there on the right, all of the things that Neuronet has been trying to do for the past couple of years, from providing an integrated view of the portfolio to impact assessment, to try to multiply communication efforts of the respective projects. I didn't delve into all of these things, but this is essentially the whole scope of what Neuronet is doing. And you can see there that if you add the red part and the purple part, which is the extremely valuable and the very valuable, I think the general consensus is that we're doing something right, probably. So I think that this kind of initiative that works trying to underpin the whole portfolio, trying to provide the glue between the different initiatives, is something that probably should be considered for the next framework programs. And with that, I think that that's the end of the presentation, Gladys. Thank you very much, and I'll be happy to take questions.